there, welcome back. The last couple of episodes were about hormone replacement therapy, my experience with it, the benefits of HRT, different myths surrounding it. So if you missed those, make sure you go back and check them out. So today I want to cover what to expect if and when you start HRT because so many women are scared to start, they don't know what to expect. And quite frankly, in the online space especially, many people will tout HRT as being like a must-have and quite frankly, a silver bullet. It's gonna solve all your problems. Well, while I certainly have found a lot of relief using HRT, I do believe that most women should consider replacing their hormones. I educate on it. I realize that not everybody's going to have the same experience. So, like I always say, when it comes to your health, it's important to be knowledgeable and then make an informed decision that works for you. Health is not black and white. All right, with all that said, you may already be on board with HRT. You may be like, you know what, Claudia, I'm good. I'm ready to go. I want to get started. Where do I begin? So you may be wondering, how the heck do I find a practitioner who will prescribe hormones to me? Many women will go to their doctor or their OBGYN and they will be met with resistance. They may say, nah, you don't need hormones, or you're too young for hormones, or you're too old for hormones, or they may even tell you that hormones are dangerous and cause cancer. Well, I dove into the reasoning behind that in my last episode because I shared information on the WHI, which was a very faulty and misinterpreted study, Women's Health Initiative, that was done many years ago that created a lot of fear around hormone replacement therapy. So please go listen to that so that you can not only get educated for yourself, but so that you can educate your provider. All right, so let me give you some tips on how to find what I call a hormone savvy provider. So this could look like a doctor or even a nurse practitioner. In fact, there's many nurse practitioners that are really knowledgeable about hormones and they can prescribe. But with that said, please know that just because somebody can prescribe, it doesn't mean that they are hormone literate. So it is important to work with somebody who understands hormones, the complexity of hormones. They have some years under their belt of expertise, and they know that it is a process. He or she shouldn't just prescribe hormones and send you on your way. No, 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 no. It can take several months to find your sweet spot. It requires patience, assessing symptom improvement, and frequent check-ins with your provider to make sure that you optimize your regimen. So in the Hormone Rescue Program, as non-licensed practitioners, we don't prescribe hormones. We cannot. However, we educate, we guide our clients on their journey so that they know what questions to ask, what to avoid, how to advocate for themselves. And since searching for a provider can feel overwhelming, we give our clients access to an HRT providers directory, which we constantly are updating, and we have it organized by state. But I'm going to give you a few tips to get started if you're like, you know what, I want to know how to find a provider right now. So I am all about the path of least resistance, especially in our perimenopausal years. We have enough on our plate, right? So if you love and trust your current provider, whether it's your PCP or your gynecologist, ask him or her about their experience with hormone replacement therapy. If they are confident in prescribing, if they are experienced in it. You don't ask, you don't get. Sometimes they just don't think to offer it unless you have verbally complained about your symptoms. But please know that most PCPs and OBGYNs and even endocrinologists just do not have in-depth expertise or experience with HRT. So while you may really like them and he or she may have been an awesome doctor for many years, they just may not have the knowledge to help you in this stage of life. Truthfully, it's more than likely that you will have to seek out a hormone specialist in order to get the support that you need. So here are a few ways to do that. And I'm going to link to these in the show notes so that you can refer back to them. So number one is you can go to or call your local compounding pharmacy. I recommend you going there and seeing if you could speak directly to the pharmacist and ask him or her who they recommend for bioidentical hormone replacement therapy in your area, of course. So compounding pharmacists, they work with practitioners every day. So they should be able to refer you to somebody who is well versed in hormone replacement therapy. Number two, you could contact a national pharmacy, such as Women's International Pharmacy. And on there, you can search by state for providers. Number three is checking out the Institute of Bioidentical Medicine, IOBIM, and these are trained providers. So the founder is Dr. David Rosensweet. I've mentioned him before. He's somebody that I have a lot of respect for. I have learned so much from over the last couple of years. He's the one who founded the Institute, and he trains these providers on, all about BHRT, bioidentical hormone replacement therapy, so that they can prescribe to their patients. So he has a training program for providers, and if you go to the website, you should be able to contact them and find a provider near you. All right, number four is the Academy for Preventive and Innovative Medicine, and this is by World Link Medical. So they also educate providers on hormone replacement therapy. So you can go to their website and they have a provider directory. And number five, you could check out the Institute for Functional Medicine. They have a Find a Practitioner tab on their website, and you can search for a hormone specialist. So just to be clear, just because somebody is a functional medicine practitioner does not mean that they are hormone savvy or hormone literate. So you'll want to search specifically for somebody who is a hormone specialist or a menopause or perimenopause specialist. All right, so once you have your provider, and give yourself some time for this because it does require research. You'll want to talk to them, you'll want to interview them, ask some questions, make sure that you feel comfortable with them. But once you have somebody that you trust and you're ready to move forward with, you're going to want to understand some of the different options. There's different deliveries of hormone replacement therapy. It can be overwhelming. So let me just go over kind of like a brief overview with you. So one is pills, okay? And that could, pills are, you can find progesterone, DHEA, and estrogen in pill form. Estrogen in and of itself isn't typically recommended because it has been shown to increase risk of clotting. But there is more research coming out on that, and it seems like more and more providers do recommend oral estrogen for its protective benefits. Another option is troches. So these are small lozenges that you place between your cheek and your gum, and essentially they just dissolve in your mouth over time. Another option is transdermal or topical hormones. So these are hormones that are mixed into a gel, a cream, an oil, or even a spray and applied to your skin in different areas of the body. Another option is patches. This is also considered transdermal because they are like sticker type. It's like a sticker type delivery system that essentially is applied to your skin. And you may have heard of the estradiol patch, probably because I mentioned it recently, because that's something that I am personally using at the time of this recording. And these patches essentially are placed on your abdomen, your hip, or your butt, and they're left in place for a specific period of time. Another option is transmucosal, and these are creams and gels that are applied to the vaginal area or mucous membranes, like inside the labia or vagina. And then there's also injections, and these may be hormones that are injected under the skin or in muscles. And then lastly, there are pellets. So these are compounded hormones like testosterone typically, or even estradiol. They're pressed into a solid compound that's about the size of a grain of rice, and these are inserted under the skin. Now, a lot of providers don't recommend injections or pellets because the dose cannot be adjusted once it's inserted. And these are invasive procedures. But again, every woman is different, and it is a personal choice. So I linked to a guide from the Women's International Pharmacy in the show notes, which covers a lot of the different options that are available to you, including both bioidentical hormones as well as synthetic hormones. Now, as I have mentioned in the past, and I will say it again, I recommend bioidentical hormones. These are going to mimic what your body already makes naturally. Synthetic hormones do not. All right, so once you start a HRT, like I said, it is an ongoing process. Patience is definitely required. And know that you may feel worse before you feel better. I want to be fully transparent about this because I don't think enough people talk about the side effects that can occur once you start these hormones. And some of those look like tender breasts. It could be weepiness. You may notice some oily skin, maybe some acne, grogginess. Your cycle length may change, and some other side effects. And of course, this depends on which HRT you're on, what dose, things like that. And I was very transparent in my episode, I think it was last week, where I shared how when I started testosterone, my skin got very oily. I even broke out a little bit. And I noticed that my period started to change because testosterone does convert into estrogen. So know that when you are introducing these hormones into the body, you may really feel a lot better, or you may not feel so good at first, but know that these symptoms are typically going to be relieved within a few weeks or so, or that you may need to adjust your regimen, really, again, until you find what works for you. So, with all that said, let's talk about what the typical process is. So most women will start with progesterone. Typically, that's going to be in an oral micronized form. Then they will add in estradiol, which is typically going to be in a patch or a gel, and then followed by testosterone, and that's typically in a cream. Estradiol can also be in a cream. There's different forms, like I mentioned earlier, and that's not always the case. This order that I just said, progesterone, estrogen, and testosterone, some providers will prescribe progesterone alone. Sometimes they'll add in testosterone. Sometimes they'll start with testosterone and then add the others in. Every provider is different. And unfortunately, some providers are hesitant to give women estrogen. So that's a little frustrating for me because, when a woman comes to me with symptoms that are very obvious symptoms of low or fluctuating estrogen, I will recommend that they speak to their provider about estrogen, and they don't always want to prescribe estrogen. And that's really unfortunate because a lot of women would benefit from it, like I mentioned earlier. There is a misconception that you shouldn't give a woman estrogen if she is still cycling or getting a period, and that's false. A lot of women would benefit from it. So please find a provider who is not afraid of estrogen. That is one question that you'll want to ask when you are interviewing. All right, so I want to break these down a little bit further. So progesterone, I've talked about this before. This is typically the first one that a lot of providers will prescribe because this is the hormone that starts to decline pretty rapidly after the age of 35. And it is a reason behind so many symptoms that women experience, like anxiety, sleep disruption, PMS, heavy painful periods, bloating, breast tenderness, and even hot flashes. So consider discussing oral micronized progesterone with your provider, but make sure that they are not prescribing a progestin. This is synthetic progesterone, and that is typically found in IUDs and other forms of hormonal birth control. Now, there may be a time and place for progestins, but it would, in my opinion, be the last resort. You want progesterone, bioidentical progesterone, because that's going to mimic the progesterone that your body naturally produces. So progesterone is meant to be taken at night to help with sleep, but some providers will also recommend you take a low dose during the day if you're somebody who experiences anxiety, or especially morning anxiety. Now, most providers will suggest that you take it only during your luteal phase, which is around days 14 to 28 of your cycle, if you are cycling regularly, getting a 28-day cycle. But others may recommend you take it continuously. At the time of this recording, I personally take progesterone continuously because I feel so much better taking it all month long. In fact, you would have to pry it out of my hands. All right. So the standard dosing for progesterone, if you're going the commercial route, the FDA-approved progesterone is 100 milligrams, and that is what a lot of providers will prescribe. But many, if not most women, actually need more than that. 200 to 300 milligrams is pretty standard. Some women need even more. Now, if you cannot tolerate progesterone, it could be due to the inactive ingredients in the commercial prescription, such as peanut oil. In this case, you may want to ask your doctor for oral micronized progesterone via a compounded pharmacy, or you may want to discuss inserting the progesterone vaginally. But some women will opt for a topical cream. Now, there is some school of thought that topical progesterone does not offer the same benefits or protection of the uterine lining as does oral progesterone, but typically this is because the dose isn't high enough. So I strongly encourage you to check out the work of Dr. Phyllis Bronson, as well as compounding pharmacist Carol Peterson on their extensive research on progesterone. It is pretty mind-blowing. All right, let's move along to estrogen. So after you fine tune your progesterone, hopefully, you may want to consider estradiol or a combination of estradiol and estriol, which is known as Biest. Because of the fluctuations of estrogen in this stage of life, it's advised to give your body some estrogen to communicate to your brain that you've got plenty of estrogen on board. Essentially, it helps to mitigate the erratic fluctuations of estrogen in this stage of life and the symptoms that come along with it. So if you struggle with low estrogen symptoms such as vaginal dryness, waking up in the middle of the night, frequent urination, frequent UTIs, dry skin, dry eyes, achy joints, then you likely would benefit from estrogen. And if you happen to be a woman who deals with menstrual migraines or hormonal migraines, these can be triggered by low estrogen at the end of your luteal phase. Again, that is the second half of your cycle as you're transitioning into your monthly bleed, your period. So low estrogen can cause prostaglandin release, and that's going to cause pain and inflammation. And low estrogen also causes low serotonin. I've talked about this on previous episodes about mood. Estrogen and serotonin have a relationship. So when your estrogen dips, so does your serotonin. And that also has an effect on your perception of pain. So it's pretty fascinating. Some women experience even joint pain or pain flares before their period. That's something that I experienced, and it was debilitating. Days before my period, I would get like full body aches, and it sucked. That's just like the honest truth. I hated it. I would get really upset about it. I didn't understand what was happening. And then when I added in estrogen HRT, it made a world of difference. I do not get those pain flares anymore. Knock on wood. All right. So consider discussing estradiol in a topical cream or gel or even an estradiol patch with your provider. They come in all different doses. There's a variety of doses, really depending on your needs. So I'm not going to dive into that at the moment. Now, lastly, some providers will prescribe oral estrogen. I mentioned this earlier. But because it goes right to your liver to be processed, and this is known as first pass liver effect versus your bloodstream like transdermal forms would, it can increase your risk of clotting. So it's not typically advised. That said, more research is coming out on the benefits of oral estrogen, such as lowering lipid levels. So as always, it's important to weigh your individual risks as well as your health history versus benefits with your trusted provider. All right, this brings me to testosterone. So there are no FDA-approved commercial testosterone options available for women at the time of this recording. Hopefully that will change over time. But some providers will prescribe testosterone that's for men at low doses for women, so kind of off-label. However, you can get testosterone via a compounded pharmacy, which is what I have opted for. So the cream can be applied to the lower abdomen, behind the knees, your forearm, or your shoulders, anywhere essentially that hair doesn't grow. It's typically used in the morning and taken continuously. So like I mentioned earlier, many providers do not recommend testosterone pellets as you cannot titrate the dose once they are inserted. The other thing to think about is it is a surgical procedure every time you need them, which can increase risk of infection in the area that they are inserted. And once the dose tapers off, you can experience symptoms of very low testosterone. So you'll have a surge in testosterone when they are inserted, and then you're going to have this dip in it, and you're just not going to feel your best. So again, it's a personal choice, but you should be informed. Now, some prescriber or providers will prescribe DHEA as well, and that is in order to support your adrenal health and to help with fatigue. Some of them will prescribe it thinking that it will produce other hormones, but in your perimenopausal and even menopausal years, it's very difficult, and you don't know what it's going to convert into. Our ovaries are not wanting to make these hormones in abundance anymore. So while DHEA can be really helpful, it shouldn't be used in place of testosterone. Typically, they are prescribed together. All right, so when it comes to HRT, low and slow is the way to go. So make sure your provider understands this and doesn't start you on really high doses right off the bat. Like I said, it is a process. It takes some time to fine tune your regimen. And you will know that your dose is not optimal because you won't feel better. Symptoms don't lie, okay? So some providers will test your hormones once you've started HRT in order to gauge your levels. But again, it's really best to pay attention to your symptoms, because if you are fine tuning and you are in communication with your provider, you will start to notice an improvement in your symptoms, and you just keep going until you feel as good as possible. All right, so that was a very basic overview of HRT or hormone replacement therapy. Truthfully, this barely scratches the surface, as it is a very complex and nuanced topic, and every woman is different and has unique needs. So in the Hormone Rescue program, we provide more education around this. We help you find a prescribing provider, or better advocate for yourself if you already have a provider, and we guide you during the process. We also help you optimize your nutrients so that your hormones can do their job, as well as support your gut and your liver health so that you can properly metabolize the hormones that you are taking efficiently. And obviously, the goal is to get you feeling your best. So we help you incorporate some food and lifestyle changes that are a must in your perimenopausal years. All right, I hope that was helpful to you, and I will talk to you next week.